If you doubt that your cat might have come in contact with a rabid animal, follow these pointers. Inspect her body to check if she has any bite marks on her body or signs of a fight. The rabies virus can live on the cat's skin or hair for a duration of few hours. So it is always recommended to wear gloves and a long-sleeved shirt before handling your suspected cat. Immediately consult your vet if you see any bite marks, scratches, or abscess on her skin. If your pet is behaving violently or is trying to attack you and you feel that you are at risk of being bitten or scratched by her, you must contact animal control to handle your cat. Though your cat has been previously vaccinated against rabies, still she will be required to have a booster shot of the rabies vaccine as soon as possible after she is bitten. This will help her immune system fight off the virus. If your cat is suspected to be suffering from rabies, then she has to be kept in quarantine for a few days and has to be prevented from escaping or injuring someone till the suspected rabies infection is ruled out. Now, what you should do if unfortunately your rabid cat bites you? Immediately wash the wound thoroughly with soap and water and seek the advice of a doctor without any delay. Immediately get yourself vaccinated with anti-rabies vaccine after exposure to the rabies virus. This is because post-bite vaccination is only effective if it is administered before the rabies virus enters the nervous system. It is highly recommended to get pre-exposure vaccination in advance for those who are likely to be exposed to rabies because of their occupation and jobs, like in the case of vets and wildlife control officers. Most important thing, if your cat has swallowed any unwanted object, never put your hand into her mouth without taking proper precautions. Your cat's saliva can enter into your skin through an accidental scratch, putting you at risk of contracting the virus. There are several ways by which you can prevent your cat from getting infected by rabies virus. Make sure your cat is vaccinated. Getting your cat vaccinated against rabies is the best way to prevent this disease. Rabies vaccine is usually given when she is about 3 months old. A booster shot is then given 1 year after initial vaccination and then at every 3-year interval. The booster immunization generally depends on the type of rabies vaccine used and the regulations of the state in which you live. Vaccinating your cat does not just protect her from rabies, but also prevents other pets and humans from getting infected if she bites them. Another way to protect your cat from getting rabies is by keeping her away from wild animals, because wild animals like raccoons, fox, bats, etc. are common carriers of rabies. Keep your cat indoors to avoid her exposure to unvaccinated and infected dogs, cats, or other animals in the neighborhood. If your cat is fond of going outdoors, then allow her to go outside only under your close watch. You should put a fence to keep wild animals and potential carriers of rabies out of your pet's play area or living area. This will help in reducing the chances of your cat getting exposed to rabies.